So for this discussion board, I think for me personally that CBT is probably going to be a go-to for me. I like the way that it helps us reframe our thoughts, and just knowing how much of our lives are controlled by our thoughts and subsequent actions, and then how much of that can be negative, just based on our own experiences, and then what we see out there on social media or on the news or just in our interactions with peers. And I haven't ever worked with anyone that doesn't suffer from some sort of anxiety about something. And so I think CBT is really helpful for that. And I think that if getting control of your thoughts and getting them into a more positive mind, getting yourself into a more positive mindset can do wonders in other areas of your life, and might allow you to address something, bigger or more difficult, past trauma, or a learning difficulty, or something like that, if you can reduce the anxiety around that issue. So to me, I just feel like it's a very broad spectrum therapy. It can benefit just about anyone, and I really just don't see very many challenges in it, because I feel like a lot of it is just having a discussion and acting in sort of a coaching manner. And just about anybody can benefit from that, whether they're seeking mental health support or not, or you're doing it in a clinical setting or not. I know in my past I've worked with a lot of foster children, and they might just need a little bit of support around something going on with school, or something going on within their foster placement, or just spending the weekend with biological mom, and just working and talking through that and setting goals is just hugely helpful to them, and then really addressing what is actually happening versus what you think is happening. And so to me, I think CBT is going to be the most useful and the most applicable across various issues and settings within social work. And while I don't know that I'll necessarily go into clinical work, I think I could definitely use it in that setting. But if I chose to work in a school, or stay within the child welfare system, or work with criminal justice, any of those substance abuse, CBT can be applicable and useful and beneficial. And so of all the theories that we addressed in the discussion board, I think it's my number one. So thanks.